अच्छा, मुझे अभी काफ़ी टाइम से ना सोशल मीडिया पे काफ़ी सारी रील्स आ रही हैं जिसमें एवरी सेकंड पर्सन इज स्टेटिंग कि ऑस्ट्रेलिया इंडियन नर्सेस को पीआर दे रहा है. सो मेरा सिर्फ ये क्वेश्चन है कि इज दिस इन्फॉर्मेशन ट्रू और आर वी मिसिंग समथिंग बिग?
See, students are missing out a lot on this because, and it's a very dangerous thing because it's actually a very real opportunity. But
Okay.
the way social media presents it, ki you finish nursing, book a flight, and automatically get a
Exactly.
Australia. It doesn't work that way. There are real exams. There's a real process. There's real requirements, and if you don't know about them in advance, you're gonna find it out in the hard way.
So abhi you were saying about the exam. So what is this exam all about?
So it's called the NCLEX.
Okay.
NCLEX-RN. Now it's a standardized exam, so basically every country wants to know that before you actually sit in front of a real patient and analyze them, they want to know that you know what you're talking about. And there's this one standardized test which is called NCLEX-RN.
Okay.
And it's not an Indian exam. It's not Australian either. It's an internationally recognized exam. And basically, if you pass this exam, the world knows that you're eligible to become a nurse.
Okay, so you're talking about NCLEX-RN. जितना मुझे समझ आता है मैक्सिमम ऑफ नर्सिंग स्टूडेंट या जो भी हमारे स्टूडेंट्स हैं नर्सिंग के, उनको पता भी नहीं होगा इस एग्जाम के बारे में. कैन यू प्लीज जस्ट इलैबोरेट दिस एग्जाम इन डिटेल कि कितना लंबा एग्जाम है, कितना टफ है और या क्या क्वेश्चन है इसके?
See, if we talk about tough, it's actually pretty tough.
Okay.
But it's considered to be very tough, at least for a nurse in terms of nursing.
Okay.
It's the toughest exam out there. But the good thing about it is that it actually adapts to the way you answer your questions. So
Okay.
if you answer one question correctly,
ठीक है.
the next question automatically becomes adaptive to that and maybe a little more difficult. And if you get it wrong, then it adapts to that as well. It adjusts to that also. So 85 to 100, 150 questions होते हैं. And it takes you about 5 hours to complete it. So it is a tough exam, but if you prepared for it, at least that's what they say, कि 4 to 6 weeks of proper studying is good enough to prepare for it.
So जितना मुझे अभी समझ आया है उससे मुझे लगता है कि एग्जाम बहुत ज़्यादा टफ है एंड इसमें स्टूडेंट मगअप नहीं कर सकता.
See, it's a different kind of pressure, not exactly mug-up, because the questions are going to be more scenario-based.
Okay.
Basically, a patient sitting in front of you, something's wrong, what do you do? So, scenario-based hota hai, it's not typically designed to test your knowledge and your memory. So, basically, it's testing your clinical judgment and not your memory, exactly. Exam is taken in Pearson VU test centers.
Okay.
It's a good thing कि India में भी available हैं test centers and you don't have to travel abroad for it.
So, अभी recently इंडिया में जैसे CBSE का रिजल्ट आया 12th का, so जो 12th के स्टूडेंट are they eligible for this exam?
So no, absolutely not, and I want to be very clear on this. 12th pass outs are not directly eligible to take this exam. You have to have done your BSc or nursing, or you have to have taken your GNM diploma. India में diploma GNM वाला होता है जो mainly 3 years का diploma होता है and then half a year of internship. So if you've done either of the two, then you're eligible to take this exam. But 12th pass outs directly are
एग्जाम नहीं दे सकते. If we talk about these students जिन्होंने अभी GNM खत्म करी है इंडिया में या फिर जिन्होंने 4 year बैचलर डिग्री नर्सिंग में खत्म करी है, इन दोनों का जो पाथवे है ऑस्ट्रेलिया में RN का वो सेम ही है?
See, it's somewhat similar but not exactly the same. Now, if you've done BSc or BSc nursing, right? And you've also taken your NCLEX-RN. NCLEX-RN की requirement जो registered nurse बनने के लिए है ही है.
Okay.
No matter where you go. So if you've done a BSc nursing plus NCLEX-RN, you can directly apply to AHPRA.
Okay.
जो वहाँ की central nursing authority होती है.
Okay.
So you can directly apply. But if you've done a GNM diploma हो गया and you've done NCLEX-RN also, now you can apply to AHPRA, again nursing authority, but they usually recommend कि आपका उस डिप्लोमा के साथ 2-3 साल का वर्क एक्सपीरियंस बेयर मिनिमम होए.
ठीक है.
नाउ ऑफ कोर्स टू गेट रिड ऑफ दैट यू कैन आल्सो एक्सटेंड योर डिप्लोमा बाय 2 years and do make convert it into
Okay.
उससे डायरेक्टली अप्लाई कर सकते हो. बट even after all of this, when you submit your application to AHPRA, they have a list of the requirements.
What are these requirements?
So there are going to be 3 requirements, which are
Okay.
very basic. First is NCLEX-RN.
ठीक है.
Now, obviously, that's there to prove your foundational knowledge. Second is an exam called OSCE. It's called Objective Structured Clinical Examination.
Okay.
This is basically, it's not a written examination. It's a practical examination. Like, blood pressure check कर लिया, medication prescribe कर ली, basic things which are practical.
ठीक है.
Not a written examination. So third is going to be your IELTS requirement, which is a 7.0 overall and 7 in each band also. Now it's very strict. OET भी ले सकते हो, which is going to be a band B and individual band में भी. So IELTS is very strict over here because 7.0 each module में चाहिए होता है, right?
Okay.
Even if you score a 7 overall, but in one band you've got 6.5, let's say writing में, they're gonna wipe out that application because that doesn't make sense. Because you're dealing with patients, right? You're dealing with patients, you're dealing with their health, you're dealing with families, which are obviously based in Australia. So English is a necessary requirement because patient safety is at risk. And I think even though it's frustrating, I think it's the right call.
हाँ frustrating तो है, but it makes sense.
See, it completely makes sense. The bar is high because the stakes are also high, right? You're dealing with patients and it's not a desk job at the end of the day.
So at the end, what about the PR? ये real भी है या सिर्फ social media reel का content ही है सिर्फ?
See, it's genuinely there. In fact, Australia has a genuine demand for registered nurses.
Okay.
But in fact, it also comes under the skilled occupations list, and PR pathways do exist. But you have to be a registered nurse first, right? You have to be a practicing nurse, not just a registered nurse, practicing nurse for a while before you can actually start applying for thinking about PR options. So it exists, but see, social media trend obviously makes it sound very easy. Overall, जिसको knowledge नहीं है इसके बारे में बड़ा आसान लगता है.
बिल्कुल.
But if you think about the entire process, it's doable, but it is difficult. It is doable. To become a nurse, it's going to be a difficult job. But at the end of the day, if you go...
But if you follow the process,
the process, then the PR pathways do exist.